Welcome to training for FHIR in Practice for Public Health, Query and Response. In this session, we explore how FHIR can enable real-time, standards-based data retrieval from clinical systems. By the end of this session, participants will be able to explain how FHIR supports real-time, query-based data retrieval for public health use cases. Describe the core principles of APIs and RESTful architecture, and identify how public health tools such as Rhapsody and Meld integrate FHIR-based workflows. We will also examine real-world use cases in sexually transmitted infection surveillance and newborn screening. At the heart of FHIR query and response are FHIR APIs. APIs, or Application Programming Interfaces, are standardized sets of rules that allow one software system to interact with another. APIs are common across many sectors. For example, they allow your weather app to request forecasts from a central server, or your banking app to check your balance in real time. In healthcare, APIs enable public health systems to actively query electronic health record systems to obtain the specific information they need, rather than passively receiving static messages. This shift from fixed one-way message formats to dynamic, on-demand queries represents a major advancement in modern public health informatics. FHIR APIs are built on RESTful architecture, which stands for Representational State Transfer. This approach uses standard Internet operations: GET to retrieve data, POST to submit new data, PUT or patch to update information, and delete to remove it. These familiar operations return structured data in formats like JSON or XML, making them easy to process, display, and analyze across different systems. To ensure consistency across systems, most certified EHRs in the United States implement FHIR APIs based on the U.S. Core Implementation Guide. U.S. Core defines how key FHIR resources, such as patient, observation, condition, encounter, and medication statement, should be structured and queried. These definitions align with the U.S. Core Data for Interoperability, or USCDI, which is a federally mandated dataset of essential clinical and demographic information. U.S. Core goes further by identifying required fields, defining standard vocabulary bindings, such as LOINC for laboratory tests and SNOME-CT for conditions, and specifying must-support elements that systems are required to provide. This level of standardization enables public health professionals to issue queries with confidence, knowing that responses from different clinical systems will be consistent and interpretable. One practical example of a FHIR-based query workflow can be found in sexually transmitted infection, or STI surveillance. Public health agencies commonly receive electronic laboratory reports using HL7 version 2. These reports typically confirm positive results for conditions such as chlamydia, gonorrhea, or syphilis. While these initial messages are critical for triggering case investigations, they often lack important clinical details, such as whether the patient is pregnant, whether they have received treatment, or whether they present with risk factors. Instead of waiting for manual follow-up, public health systems can issue FHIR-based queries to retrieve these missing data elements directly from the provider's EHR system. To support this process, the CDC has developed the Data Integration Building Blocks, or DIBS, query connector. This middleware tool helps public health systems identify reportable conditions and construct standardized FHIR queries to gather additional information. When a positive STI lab result is received, an integration engine, such as Rhapsody, detects the message and alerts the DIBS query connector. The connector then uses information from the lab report to generate a targeted FHIR query. This query is sent to a clinical FHIR server, such as a test environment built on the Meld platform, which contains synthetic patient data and simulates EHR functionality. The server responds with structured FHIR resources such as patient, condition, observation, and encounter. These responses, formatted according to U.S. Core, fill in the gaps needed for public health case investigation. They can be integrated into surveillance systems, reducing the need for manual data collection and improving the completeness and timeliness of the case record. Another use case involves maternal and newborn health, where timely access to screening and discharge data is critical for follow-up and early intervention. In this scenario, FHIR can be used to exchange newborn screening information such as early hearing detection and intervention results, critical congenital heart disease assessments, and relevant family medical history. When a newborn is discharged, the hospital generates an HL7ADT-A03 message, which is detected by an integration engine like Rhapsody at the Public Health Agency. This event triggers a FHIR query to the hospital's EHR system. The initial query uses demographic details such as name and date of birth to retrieve the internal patient identifier. This identifier is then used in a follow-up query to retrieve the baby's screening results. It also retrieves an observation that links to family history information, which can reference a family member history resource containing data on genetic conditions, risk factors, or hereditary diseases. These FHIR responses are transformed into readable HTML summaries or converted into HL7v2 messages for downstream systems. As with any technology, there are important implementation considerations. The usefulness of the retrieved data depends on the quality and completeness of what is stored in the clinical system. Not all FHIR servers expose the same resources or fields, so it is essential to review the server's capability statement, a document that describes what data types and interactions are supported. Secure communication also requires proper registration, authentication, and access control. Retrieved data often needs to be mapped to existing formats like HL7v2 and validated for completeness and consistency before it can be used. Public health professionals can use sandbox environments such as MELD, along with tools like Postman or custom Python scripts, to develop, refine, and validate FHIR queries before deploying them in a live system. In summary, FHIR-based query and response workflows offer a powerful way for public health agencies to retrieve data directly from healthcare systems. By using standardized APIs, RESTful protocols, and implementation guides like US Core, these workflows reduce reliance on manual processes and improve the quality, timeliness, and completeness of the data. Tools such as the CDC-DIBS Query Connector, integration engines like Rhapsody, and test environments like MELD support the real-world implementation of these approaches. As FHIR adoption expands, query-based access will become an essential tool for public health professionals, enabling faster case investigations, more complete records, and better-informed public health responses. We hope this session has provided practical insight into how FHIR-based query and response workflows can strengthen public health surveillance, screening, and follow-up. We encourage you to explore the tools and methods presented here, experiment with queries in a sandbox environment, and collaborate with your technical teams to bring these approaches into your own programs. Thank you for joining this session.